Thank you, Honorable Speaker. First, let me commend the chair of the Health Committee and all the members of that committee for the very good work that they did following your instructions in Naivasha. And indeed, they have, the committee and the ministry officials have gone at great length, and listening to what the chairman has said and what Professor Nyikali is saying is indeed true, that there are many transitional issues that need to be addressed. But we can only encourage the management of SHA and the ministry officials to make sure that those transitional issues are sorted out and people are well informed ahead of time on the things they need to do, Honorable Speaker. Because if there's anything that has suffered from the negativity that we have experienced in the country, is SHA. And unfortunately, Honorable Speaker, as you have severally said in other fora, it's sad that even for us in the political class, we have contributed to that negativity and misinformation. Because it becomes very sad, Honorable Speaker, when you see a member of parliament stand up in public because they think what they will say to the public is politically expedient and popular with the public, and say things that they do not know whether this is sha, she, or she, sha, she, or shu. Yet, what they are calling sha, she, or shu, Honorable Speaker, as a member of parliament, whether you sit in this house or the other house, because these laws, the 4 laws that we passed, were passed by members of parliament in both houses, Honorable Speaker. And there is not a single provision in those 4 laws that was not considered by this house and the other house and adopted. Therefore, it's very embarrassing, Honorable Speaker, when you hear a member of parliament saying, sha, she, shu, yet you are part and parcel of the enactment of those laws. Honorable Speaker, leadership calls for what you have heard Honorable Nyikali say here, that there are issues, and what the chairman is saying. There are issues that the ministry and the SHA management ought to be addressing. Top among these issues, Honorable Speaker, is a question of pending bills. Honorable Speaker, if you listen to the conversation in the country on pending bills, you may imagine that pending bills are only there in SHA. Yet nobody is telling Kenyans that 99% of the pending bills in SHA are inherited problems from the old NHIF. True, Honorable Speaker, nobody is telling Kenyans that out of the 19 billion that was inherited from NHIF, the defunct NHIF, by January, 9 billion shillings have been paid, and the pending 10 billion shillings are bills that are undergoing verification. Honorable Speaker, the chairman will tell you from the engagements with the Health Ministry and SHA management that quite a number of those bills are also fraudulent. But you know, Honorable Speaker, because corruption fights back, and when corruption begins to fight back, they are so vicious that their lies, their propaganda takes center stage ahead of the truth and factual information. And that's why I'm saying, Honorable Speaker, if there is anything the Health Committee can do for us, even as you consider the Supplementary Appropriations Bill, is to ensure that the SHA management has adequate resources to make sure that proper information is going out to the public, Honorable Speaker. Because it's embarrassing, Honorable Speaker, when I see even bishops pontificating on pending bills, as if even the faith-based hospitals, Honorable Speaker, that are owned by the defunct NHIF have just sprung up when SHA came into existence. And the same bishops who are pontificating, Honorable Speaker, are pontificating and telling us that you should not even be advertising what government is doing. Honorable Speaker, you know, when you are a bishop, you get to church every Sunday and advertise the good work of the Lord by preaching to the good people to convert and become good Christians, Honorable Speaker. It's the same for government. Government is the business of delivering services, and we are obligated by our own constitution to make sure that Kenyans have access to information and the right information. But I know some of these people, Honorable Speaker, pontificating out there, they are pontificating because they are pained, and pained by the truth that it is true, Honorable Speaker, that even within the faith-based hospitals, there are very many fraudulent claims that have been caught up in the verification process. But because you want to pontificate and make Kenyans believe that government is not doing anything to address the problems that bedevil even the faith-based hospitals, Honorable Speaker, you want to make the whole world believe that since the advent of SHA, no pending bills have been paid. Yet, as we are saying, Honorable Speaker, out of 19 billion, 50% of those bills that have been verified have been settled. And it is only right, Honorable Speaker, to plead even to those of our bishops who are running some of these hospitals, as much as you may not like this administration, give them what is due to them. Give credit where credit is due. But also, as you pontificate about the fight against corruption, speak about corruption and fraudulent claims from the defunct NHIF also being perpetuated within faith-based hospitals, Honorable Speaker. Honorable Speaker, we've also seen this week, Honorable Speaker, the private health, the Association of Private Health Hospitals and the Rural Private Health Association called their members to go to strike, Honorable Speaker, again based on those pending bills. And I'm glad, Honorable Speaker, when I checked with the SHA management this morning, they were telling me as of yesterday when the strike was on, 1,700 private hospitals, members of those associations, were already logged into the system and offering Kenyans services. And that's why I want to appeal to those who are running these associations. I know is the spirit of trade union and the politics of leadership of association to be seen to be agitating for things, but they must be cognizant that healthcare is not a matter that you can joke around with. It is joking around with the lives of Kenyans. Lastly, Honorable Speaker, in terms of being able to relay proper and accurate information to Kenyans, Honorable Speaker, I want to encourage the Health Committee, the SHA Management and Ministry of Health, and that's why I spoke to the Health Committee to consider within the supplementary budget to enhance the publicity and advertising budgets for SHA. Because, Honorable Speaker, part of why Kenyans are being misled is because they have not been given factual information, especially around the space of the primary health care and the referral system. And this referral system, Honorable Speaker, if you go to UK, the NHS works under a referral system. But today, as Honorable Nyikal was saying, you will probably find somebody has walked into a primary health care facility, his entire bill is settled, then they walk into a referral hospital and the bill is not catered for, not understanding that you begin from the primary healthcare facility to be referred to the referral through the referral system to a referral hospital or a level 4 or level 5 and 6 hospital. With that, Honorable Speaker, let me just say mine is to encourage the Health Committee to continue working with the Ministry and SHA management to perfect the imperfections that are there in this system, because this universal health coverage system is something that has been elusive in this country since the times, Honorable Speaker, when you served in cabinet under the able leadership of the late President Mwai Kibaki. And you know, Honorable Speaker, under Mwai Kibaki's regime, we attempted to roll out the universal health coverage, and it came to a cropper because of this negativity, Honorable Speaker. President Uhuru Kenyatta again tried, and again because of the noise and the negativity that you hear today, Honorable Speaker, he had to run away from it, and after rolling out in only 4 counties, I think it was Mombasa, Kisumu, Isiolo, and Machakos Onyeri. Again, it was abandoned. We have no luxury of time, Honorable Speaker, to now abandon the quest for universal health coverage at the altar of political expediency, and we must encourage President William Ruto, the SHA management, Minister in charge of health, and our own health committee to help the ministry and SHA midwife this process with courage, knowing that what they are doing is right, and right for Kenyans and right for this country, because at the end of the day, when you are assured of universal health coverage, every other Kenyan will live a peaceable, healthy and productive life, Honorable Speaker. And I beg to support that report by the Chair.
Honorable Pukose, most of the